Anyone with a child will tell you having a baby is life changing in all of the best ways, but in a lot of ways that are also hard. At the time of pregnancy and that first year of early childhood is critical not just for mommy, but children biologically and developmentally.
What happens in this really brief window of pregnancy, infancy literally shapes your entire life course. And when I first learned that this is when families are poorest, I kind of freaked out because like as a pediatrician, this is the most important window of child development.
That's Dr. Mona Hanna. You might know her as the doctor who is at the center of the Flint water crisis.
Known as Dr. Mona, she has helped expose the Flint water crisis in 2015.
The Flint pediatrician who helped expose the dangerous levels of lead in Flint.
The turning point came when a local pediatrician found conclusive proof that the children of Flint were being exposed to high levels of lead in their water and prompted the state to declare an emergency.
Dr. Mona helped to guide the city of Flint through a monumental public health crisis, and she fought for Flint to have safe drinking water flowing from their faucets. She's now taking on a different public health crisis: poverty during pregnancy.
And we are the only country in comparison to peer countries that does not have paid parental leave.
Dr. Mona's new program aims to change that, and it's called RX Kids.
It is the nation's first community-wide maternal and infant cash prescription program.
Yes, you heard that right. Cash prescriptions. A prescription for money. A program that is giving every expectant mother in the city of Flint no strings attached cash funding to help with the myriad of expenses and financial stressors that come along with having a baby.
RX Kids started in Flint in 2024. Now, a year later, they're in 8 different Michigan counties.
Like this is not a teeny itsy bitsy pilot. This is like the largest cash transfer program right now in the country. And we are literally eliminating poverty and improving health.
Welcome to PathBreakers, a show about what it takes to cut through the noise and red tape and all of the other obstacles to progress. I'm Tracy Pearson, and I work on the communications team at the Kresge Foundation.
And I'm Jamie Bennett, and I work at the intersection of arts, culture, and equitable community development. On each episode of this series, we talk with a different pathbreaker who's forging a new way forward.
Today, we're talking to Dr. Mona Hanna about what happens when you ensure economic stability for new mothers and do it in a way that centers love and trust. Well, let's get started. So, Dr. Mona, you saw something that others were unwilling to see in Flint, or perhaps unable to see. What within you refused to look away? And of course, I'm talking about that very, very unfortunate situation with the water. What gave you sort of the moral clarity to act, even when other institutions resisted seeing what was sort of before them?
So, Tracy, you pretty much kind of summed up the title of my book, which is What the Eyes Don't See.
Mm,
So there was a blindness. There was a blindness in Flint to our kiddos, to the problem, to the place. So many people refuse to see this crisis, this emblematic environmental and public health crisis that was potentially threatening, the future of an entire population of children. And when I heard about the possibility of lead being in the water in Flint, like I could not unsee. Like once I heard that possibility, like my life changed. And that was driven by a lot of things, but most importantly, it was driven by kind of my role as a pediatrician in the community. Like I have literally taken an oath to protect children. And that means not just making sure that they're healthy today and doing their checkups and giving their vaccines, but it is about making sure that our kids have the brightest future possible. And knowing that there was lead in the water, even the potential of lead in the water, really afforded me a choiceless choice of just moving forward, being driven by our kiddos, and making sure that they had the brightest future possible.
And how did you even know there was lead in the water? I mean, I know there was some conversation about this, but I mean, you don't work in water, you don't work in public works. I'm guessing you're not a welder. Like, I mean, how did this come to be known and so present for you?
Jamie, I actually am a welder. No, just kidding. I'm not a
Oh,
welder. I'm
gosh,
not a
dang
plumber.
it.
But I I was a kid that grew up in Metro Detroit that really got into environmental activism. Helped shut down an incinerator when I was in high school in kind of Kresge's backyard in Madison Heights. And that kind of environmentalism pushed me into a career in environmental health, but pushed a lot of my peers that were so involved in this environmentalism in high school into other really awesome environmental careers. So my best friend in high school became an environmental engineer, and lo and behold, became a drinking water expert. She worked at the EPA, went on to work at like other water agencies in DC, and then she decided to come back home to Michigan to be closer to her family. So my bestie, who I've known forever, who is of all things a drinking water expert, was at my house, and like we were just hanging out, chilling. Our kids were playing. And it was through her that I learned that Flint's water wasn't being treated properly. And because it wasn't being treated properly, it was going to be super corrosive, which meant that whatever was in the plumbing was going to come out of the plumbing and into the drinking water. So it was my high school girlfriend over a glass of wine in my house with our children running around that first kind of, let me know of the possibility of lead being in the water. So make all kinds of friends, stay connected to besties. I think that's one of the most important lessons I've learned is just how critical it is to, be surrounded by people who do different things. We live in a very, very siloed environment. We hang out with folks who are just like us, and it is so important to hang out with all kinds of different people with all kinds of different backgrounds and experiences because we ask different questions and we come up with different solutions.
Yeah. I what I'm hearing is community because
Yeah.
I have a 5-year-old and an 8-month-old. And so
Oh,
much of what I know about mothering, I get through community. And
yes.
we solve our problems in that community. And I love my pediatrician and I love the school system, but it's when I'm in community with other and different types of parents and
Yes.
caregivers that I learn and get so much. So I love that is where that dialogue happened and how that sort of got the ball rolling on this really big issue being addressed. I want to ask you, how did you arrive in Flint?
Oh, that's a great question. And I'll only spend like the next 2 hours answering it. Just kidding. So, my family immigrated to this country when I was about 4 or 5. So we are Iraqi American. So came here kind of for freedom and opportunity and an American dream, but actually landed in the Upper Peninsula of Michigan. My dad did a postdoc at Michigan Tech University. He's a metallurgical engineer. After a few years in the UP, we came downstate and he worked at General Motors, and my mom became a teacher. And grew up in Metro Detroit, like so much of the Arab American diaspora. Went to school at the University of Michigan for my undergrad in environmental health, which I kind of created on my own. But then went to medical school at Michigan State University, the College of Human Medicine, which is this really neat and different kind of medical school. It's really kind of, I think, the embodiment of the land grant university. It's all about serving the people of our great state. It's the very first community based medical school in the country with this mission of serving the underserved and really kind of a primary care focus. So it was definitely kind of the work that I wanted to do. And from the beginning of the medical school, they had a focus of, training clinicians in all parts of the state. So there's been a UP campus like forever, campuses throughout the state. And there's been a campus in Flint for over 60 years, training medical school students. So I was a medical student where I did my last 2 years of medical school in Flint. And that is where I fell in love with the city. I fell in love with the people. I fell in love with the history and the grit and the loyalty and the pride. And that's also where I fell in love with pediatrics. I just fell in love with the little people. And then I left. I left to Detroit. I went to the Children's Hospital of Michigan in Detroit, where I did my residency training. I stayed another year as a chief resident, stayed a few more years at Wayne State University. And then in 2011, the opportunity came to come back to Flint as a residency director. And it was just this kind of perfect moment for me to give back to a city that had given me so much and to kind of be in a position to train the next generation of pediatricians to really not just treat, ear infections, but try to address these upstream inequities that make our patients sick.
Tracy, how does it feel that she picked Flint over Detroit?
Yeah, I love for both. Love for both.
We've spent some time in the Children's Hospital in Detroit, so thank you for your service and your colleagues' service there. But it's for the babies, and I want all babies to have excellent
All
care.
babies, all
You
babies,
know,
all
so
babies.
yeah,
I
all
I
the
love
babies.
I love children's. I was there before it became a for profit. I was there. I don't know, maybe I'm being nostalgic, or I was there during the best time.
Hmm.
And I am so grateful for my training and for the ability to be there. And I never thought I would have left children's because it was an amazing place. It's this massive freestanding children's hospital. I was in charge of training of hundreds of people. It
Mm.
was it was joyful work. And like I actually like I didn't want to leave. And then I my colleague pushed me to interview in Flint. I'm like, I am not going to Flint. Like, why would I go to Flint? It is this tiny, tiny hospital. Like, why would I leave Detroit? She's like, just go, just check it out. And it was when I went to Flint, I realized like, the same struggles are in Detroit that are in Flint, and this is another community where they need people. They need folks who care, kind of who are leading kind of with their heart. And it was a challenge, and I love challenges. So that's one of the reasons that I came back to Flint. But I think the biggest reason that I came back is that Michigan State University was about to take a deep dive in Flint in terms of public health.
Mm.
They were doing something that had never been done before. They asked the community of Flint, "Hey, if we were gonna like build public health here in Flint, like how would we do it?" So all of MSU's public health programming is based in Flint, and that's driven by community. The community identified big issues that they wanted the university to work on. The university hired translation researchers not to just like observe and study, but really to make things better. So that is also what drew me back to Flint to be able to be part of this ground up, never been before done effort to work hand in hand with community to address big issues in public health.
And can I ask, I don't mean to be dense, but sort of when I think about health and when I think about doctors, right? There's someone I go see in a room once a year who sort of, pokes at me, prods at me, writes me a prescription if I need it, right? I mean, health and doctors is something that take place in a closed room in a hospital or clinic. But help me into understanding what this public health is.
Jamie, that is such a good question. And I think this is kind of something that a lot of folks are confused about. They're like, there's health care and there's health. And we spend and we people confuse the two, like aren't they the same thing? And they're actually not the same thing. So healthcare is that one-on-one, that often in a hospital or clinic encounter that we have with people. And we spend a lot of money in this nation. Actually, we spend more than any other country on health care, which is by and large a sickness based system. It's a profit driven, sickness based system that is after the fact and reactive. We don't focus on health. And that is keeping people healthy. And that's often what the kind of the domain of public health is. It is stronger environmental regulations. It is economic stability. It is universal childcare. It is, all these other things which are normal in other countries that keep people healthy. And because we don't spend much on public health and because we spend so much on healthcare, our health outcomes as a nation are actually kind of terrible. In terms of maternal mortality and morbidity and infant outcomes and life expectancy. So there is a mismatch in terms of where we invest and what our outcomes are because we don't invest in prevention and public health. So I often say, like, we are putting really expensive band-aids on bleeding social wounds
Mm.
because we are not investing in health and we are reactively spending a lot on healthcare.
So that kind of brings us to this RX Kids program. So what is RX Kids?
Oh my gosh, Jamie, ARCS Kids is like pure love and joy. We call ARCS Kids a prescription for health, hope, and opportunity. So I'm a practicing pediatrician to this day, and it is my greatest joy when I get to hang out with our kiddos. And for so long, I have felt frustrated as a pediatrician because I have been unable to treat this really terrible pathogen, this thing that makes kids and communities sick, which is poverty. And I end up treating the consequences of poverty, be it missed appointments or developmental delays or failure to thrive or childhood obesity, or the list goes on, because we have not addressed this root cause, this social determinant of health, which is poverty. And it turns out that families are poorest in this maternal infant period. So, all those folks out there who are listening who've had a child, like, oh my God, when you are having a baby, like, there is so much stuff you need to buy, like car seats and strollers and diapers and pack and plays. And, like, the list goes on and on. It's estimated that just that first year of life is an added $20,000 in expenses. And this is happening at this time of a perfect storm where income is dropping. Moms often have to come out of the workforce. So there's a drop in income, expenses rise. So this is a perfect storm of an economic shock, the greatest economic shock in your life course. We have learned so much in terms of early childhood and the consequences of early adversity and toxic stress. Literally, what happens in this milieu, this short period of time, predicts what happens on later in life. And we, as a society, as a nation, have been abandoning our mamas and babies. So when I'm in clinic and I'm holding a little newborn in my hands, and that newborn is like wide-eyed and staring at me, right? With like bright-eyed potential. Like, it is so frustrating when I know that zip code that kid is born into. And I know that zip code and that environment, that milieu, that situation is predicted of anything, it is predicted of their life course more than anything else that I can do as a clinician. So ARC's Kids is like this bold, impossible effort to say no, to refuse the status quo. And kind of in the same spirit of our work with the water, like Flint's story, the story of our environmental crisis, more than the story of a crisis, it is a story of resistance. It is a story of a group of people that came together and said, no, we can do better on behalf of our kiddos. And we resisted. And since then, we have been building hand in hand with community and so many partners, a model of recovery to make sure our kids have the brightest future possible and to make sure that kids everywhere and communities everywhere don't have to go what we have gone through. And in that same spirit of resistance, we are now resisting to have our babies, our precious babies, being born into and growing up in poverty. So RX Kids is this impossible effort of eliminating poverty for mamas and babies. So every pregnant mama in the city of Flint gets $1,500 in the middle of pregnancy. And then once a baby's born, it is $500 a month. It is for everyone. No strings attached, no conditions. And that universality and that unconditionality conveys these really important values, dignity and deservingness and love. Love. This is a program built on love and trust and freedom and choice, all of these values that are not seen in other kind of social programs that often are stigmatizing and shameful and often administered in very kind of systemically racist ways that have vilified our mamas and our babies. So we are upending all of that with RX Kids. So that's what RX Kids is. And it started in Flint. We're in 8 counties already in Michigan, and it's spreading all over the nation.
Dr. Mona, you are really talking to me. I will tell you, just fully transparent, when you are in that period of carrying a child, you feel so vulnerable.
It's so hard.
You're doing the test and you're going to the appointments and you got to buy this and you got to do that. And so to have that added stress of financing all of this be removed,
Mm-hmm.
that is monumental for mothers and families and people just wanting to support mothers and knowing that they'll be okay. Like, you don't have to worry about how you will get to that doctor's appointment because you can pay for the Uber there now. You can pay for the whatever you need, medications you need. So it's wonderful.
You can pay for rent. You can pay for
Rent.
food. You don't have to worry between
Yes.
diapers and dinner. And we hear that. We're seeing that in the data. That stress relief that mamas saying, like, I can breathe. A weight's been lifted off
Mhm.
my shoulder. I can be present. I can be the amazing mama I always knew I was.
Yes.
Absolutely.
And you said this word deservingness, and many policies are built on this idea of deservingness, and that's terrible. But our kids rejects that. What message do you hope the program sends to mothers of Flint, but also to policymakers across the country that can implement this
Yeah.
in various other communities?
Yeah, so, ARCS Kids is once again, we started in Flint in January of 2024, thanks to Kresge and thanks to so many amazing partners. And then this year, we're in the city of Kalamazoo. We're in 5 counties in the eastern Upper Peninsula. We're live in the city of Pontiac. It's about to go live in other kind of Southeast Michigan communities. There's there's legislation right now in the state to make it a statewide thing because everybody wants this. Everybody needs this. It is so common sense. And really kind of we've had bipartisan support. All kinds of folks understand how hard it is to bring a baby into the world. Like, people are like, "Oh my God, Mona, your job is so hard." I'm like, being a mom is so hard. Like that is being a parent. It is the hardest job in the world is to be a parent, especially kind of in that first year of life. So we're excited about the enthusiasm throughout the state and really throughout the nation. There's a lot of other states that are looking at adopting ARCS kids as well. And once again, it is about economic stability. This is an evidence-based program. Programs like this are done throughout the world. This is not a new brilliant idea. This is really based on mountains of evidence. We did something like this as a nation during the expanded child tax credit in 2021, where child poverty dropped to its lowest level ever. That was not renewed by one vote in the U.S. Senate. So it became really important to do something to keep this work in the public imagination at a scale that hadn't been done before. Like we are running the largest cash transfer program in the country. That's amazing. So yes, we're eliminating poverty. We have amazing health outcomes. But Tracy, what is the most exciting thing is these values that we are sharing and the narrative work that we are doing. We celebrated the launch of ARCS Kids last year on Valentine's Day because it's about love. This year, the UP program was announced on this year's Valentine's Day. Every baby in Flint gets and any ARCS Kids community gets a onesie when they're born that says love and another onesie that says best baby ever. And they get a card from the governor of Michigan, every baby that says, welcome our newest Michigander. We are so happy you're here. We love you. And we can't wait to see what you grow up.
And we care about you.
We care about you. We care about you. So, this work is about all these different outcomes, but it's also so much about how can we reimagine the social contract? Like, how can we reimagine that relationship that individuals have with government and institutions and academia and philanthropy? And, I was with a mama yesterday who was part of the program, and somebody asked her, like, when you think of this program, who do you think is bringing you this program? And the mom said, I see it as a whole community that has come together to support us. And that's what it is. Because this program is led by a university in partnership with a nonprofit, but the funding is public and private. There's state dollars and federal dollars and philanthropic dollars and corporate dollars. So there's a whole community that has come together to support our mamas and our families in this kind of historic place-based way. Those values are so much that are part of this program. And that's something that we, hope to continue to instill as we continue to expand. And we're actually seeing it play out, not just in these anecdotal statements by moms, but in our big surveys and our big research data, our mamas who are part of ARCS Kids feel more loved. They feel more respected. They feel more empowered. Our moms actually have more trust, which is amazing, in government institutions. We actually even are seeing more civic engagement. In the last election, we actually had more women of childbearing age in Flint turn out to vote and register to vote in comparison to any other community and in comparison to men and older women. So really, really great other data points that are showing that these values, which we think are so critical to this program, once again, of dignity and love and deservingness and trust, are also being translated.
Can I ask? So, this notion of cash prescriptions is so interesting for me because, on the one hand, poverty seems like a relatively easy thing to cure. You just give someone more money, they're no longer poor.
100%. They don't need like 10 million parenting programs to tell them what they're doing wrong. They just need to not be poor.
Well, and so then let me channel some folks that aren't on board with this and say, if
Jamie,
you
everybody's on board. Like
Well,
everybody is
but
on board with this.
well, except one vote in the Senate wasn't on board with this.
That's right.
Well,
That's right.
and just to say that, so there's this notion that if you wrote me a different kind of prescription, you would tell me to take it 3 times a day. You would tell me to not eat grapefruit. You would tell me when to stop taking it. And I sort of don't want to ask this question because it's not a Jamie question, but how do we know that those families are going to do the right thing with that cash prescription?
Because that's what they do. Because that's based on massive global and domestic evidence that when families have the resources, they do what they need to do. So, for example, in our research, in our kids, so the most common thing that families spend their money on is baby supplies. And when you break down baby supplies, it is diapers. That is the most common thing that folks spend their money on. Then it's food, rent, utilities, transportation, childcare. And that is also consistent with the global evidence for the Extended Child Tax Credit, what people spent their money on. And then, we can put requirements. So we could say, oh, you can only spend this money on food, or you could only spend this money on this, or we could, but you know what? When we do that, the values change. It is telling our mamas, we don't trust you. We don't trust you to know what is best. And that's not what this is all about. But also when you add all those requirements, those paternalistic patriarchal requirements, it costs more money. It becomes administratively more burdensome. And that's also something that, folks are not supportive of. I think the reason that we have such bipartisan support for this program is because we are such an efficient program. There is very, very little bureaucracy. This is a low overhead program. It is also a very time limited program. Starts in pregnancy. It either ends at 6 months or it ends at 1 year. It's just a short window of time. We're not policing people. We're not figuring out who's in, who's out. The universality makes it really easy for folks to understand. And it makes it easy to administer. If you add any of those things, it increases kind of the cost. So this week there was an article in the Detroit News about RX Kids, and it's spread across the state. And there was a great quote, and I'm pulling up right now, from the Mackinac Center for Public Policy, which is like a pretty conservative think tank.
Yeah.
And it gets right at that one. I'm looking forward. I'm going to get to it right now. I'm going to keep talking. Oh, here it is. Okay. So the director of research at the Mackinac Center for Public Policy said that while he doesn't believe it's possible to completely prevent the misuse of direct cash assistance, providing the subsidies without strings is still more cost effective than the overhead and administration expenses that come with a more traditionally structured government social welfare program. He went on to say, I think even recognizing that some of this money is going to be ill-used is still more efficient than setting up a whole government program and trying to deliver services through a new arm of government. So that efficiency is key. But once again, it's the values that we are sharing, that we trust you to know what's best. And that flexibility for families, like some families have diapers, but they need food. Some families have food, but they need to pay their car payment. And some families, that's okay, but they need housing. So that flexibility also enables us to address so many different needs. And we're seeing that in the data. For example, we have massive improvement in housing stability. We had no evictions in our surveyed mamas last year. We have less
You had no evictions?
No evictions in our low-income mamas that were surveyed last year. In Flint, the poorest city in Michigan, we have no evictions in our surveyed moms. And this period of life has some of the greatest residential instability, and we were able to address that housing crisis. Our mamas were able to pay for childcare. So there's these poly crises that we are facing: housing, childcare, affordability, health, maternal health. And this simple program that is administered so efficiently is addressing all of these crises.
That's beautiful and amazing for them. I want to talk about you a little bit. This is a very path-breaking program.
Yeah, that's a great word, path breaking. You guys should come up with like a podcast named Path Breaking. Such a good word.
Oh, double her grant, Tracy.
What would it take to scale ARC's kids beyond Flint? And what role do you think sort of philanthropy, government, and civic infrastructure
Yes.
what would it take to make it possible other places?
When we started ARC's Kids, just like everything that we have done in Flint, be it from pipe replacement or environmental justice work, it's once again, it was never about Flint. It was about figuring it out and then sharing our best practices to communities across. We figured this out in Flint. We developed this plug and play program that's already kind of spread across our state, and that is easily scalable to the whole state and to other communities. So with dollars at the table, we're ready to go within months. We can launch in Detroit if dollars are at the table. We already have kind of commitment from the state, with for some of the funds. But right now we need other match dollars to make it possible in other communities. So I think of especially philanthropy, and I'm stealing something that my dean said. He's like, I see philanthropy as a doula of this program. Like it's helping bring it to life. It's helping birth it. But our goal is always to make this like a sustainable government, like scale public program, and that's absolutely where we're headed.
And I was trying to do the math as you were talking. It's about $7,500 per mother to support her
Yes.
and her baby through the first year.
Yeah. So in Flint and Kalamazoo, we've been able to raise so much money that it is a prenatal and 12-month program. But in our other communities like the UP and Pontiac and other places, it's a prenatal plus 6-month program based on how much money we've been able to raise. So in some places, it's $7,500, and in other places, it's about $4,500. So there's about 100,000 babies born in Michigan a year. So the math is not terribly hard. So to do this for the whole state, it's about $750 million dollars that would be needed per year if it was a 12-month program. And then if it was a shorter program, it'd be about $450 million dollars a year that would be needed. And yeah, I can't see how we can't afford not doing this. Like, once again, every hour, every day that goes by when a baby is born without the resources they need is a failure on all of us as a society. And we're already even showing kind of the cost savings. Like we prevented about 40 NICU admissions last year. We've impacted birth weight and gestational age. We have less child welfare involvement. All of these afford cost savings to the state and to the society in the short term and the long term. And that's also consistent with kind of evidence on cash transfers in this window of life.
And that's even before you get to the cost of what happens when a family is evicted or I mean,
100%.
there's all of the sort of non-healthcare costs I can't believe I'm saying this, but $750 million seems cheap.
No, it is. It absolutely is. Even if a mom lives in a community with a high rate of eviction, even if she's not being evicted, but there's a lot of people in the community being evicted, that alone can increase the rate of premature delivery and low birth weight, and that is a massive, health issue and a cost issue. So there's massive kind of benefits that are really unquantifiable.
That's awesome. And then the Kresge Foundation, I'm sure there's another foundation called the Skillman Foundation. And one of the things that the Skillman Foundation sort of thinks a lot about is the Maasai people in Africa have a greeting when they meet each other that goes, "And how are the children?" Right? Not how are you, not how was your day, not how are you doing, but how are the children? Right? Because they believe that if the next generation is doing okay, things are going all right. Does that spark anything for you? Does that bring up anything up?
I love that so much. And we're also grateful to the Skillman Foundation, who are supporters of ARC's Kids. They're actually funding the mailing of all the onesies to all the babies in the state. I love that. How are the children? That's my why. That's why I wake up every morning. That's why I do this work, is for these kiddos. They are all our kiddos, and they're not doing okay right now. We do not care about our children, kind of as a nation, and we need to do better. And ARC's Kids is kind of one path forward.
Yeah, yeah. All right, we're going to close with our lightning round. Tracy, I'm just
Yes.
pulling up my list, and
I
I
will
think
start.
you are kicking us off.
Yes. What's the first word your friends would use to describe you?
Probably energetic.
When you were 10, what did you think you were going to be when you grew up?
A journalist.
Me too. What age is the best age?
Oh, I would say 9 months.
It is a sweet age.
It's at the new developmental milestone, like every day. Like every day, babies between 6 and 12 months are doing something new, and it's so much fun.
Xavier, my 8-month-old, just discovered his hands, and all day long, he's just shaking his hands and looking at them. It's the best.
Fun. It's so fun. It's so fun.
Right now, what tabs do you have open on your computer?
Oh my God. 3 different email accounts, 2 different calendars, shopping, like all kinds of different things.
Describe Flint in one word.
Path-breaking.
Oh, well done. Coffee or tea?
Oh, coffee.
What's the last song that made you want to dance?
I've been playing REM in my car, so I'm stuck in the 1990s. So, Shiny Happy People.
I love that. Close your eyes and make one wish for the next generation.
Oh my goodness. That every baby, no matter the color of their skin, the country of origin, the zip code, the state of birth, the drinking water source, can be whatever they want to be.
Who was one path breaker who made a way for you?
Oh, so many pathbreakers. My book is so much a tribute to so many folks who walked before me and walked alongside me, who made me who I am. None of us is here because of just us. We all stand on the shoulders of giants. I'm gonna say close to the heart and say my mom. My mom is a badass. She's a tough woman. She was a chemist back home in Iraq. She retrained. She became an ESL teacher here in Michigan. She's strong. She's smart. She's amazing. She's enabled me to be who I am.
Say your mom's name.
My mom's name is, so her name is Talia, but in Arabic it's Talia. But Talia.
Oh, that's awesome. If you had a pad big enough, what's the prescription you would write for America?
Oh, I love this. I would, let's stay with the ARC's themes. I would end child poverty.
Beautiful. Dr. Mona, we just want to say thank you so much for all you have done for the state of Michigan, the young people in Flint. Thank you for joining us today. We really do appreciate you.
And we want to make sure that we've got a link to your book, a link to that Mackinac article, and we'll put all that in the show notes. And we'll make sure that anyone who wants to bring RX kids to their community, their city, their state, has a way to reach out and get in touch. Thank you so much for what you're doing today.
Thank you. Thank you, Tracy and Jamie. This was so much fun. Thank you for what you do. And thank you to the Kresge Foundation and an entire village that has come alongside to support this program. Thank you.
Dr. Mona Hanna is a pediatrician and professor with the Michigan State University, where she is also the Associate Dean for Public Health and the founder and director of RX Kids. We put a link to rxkids.org in our show notes.
PathBreakers is produced by the Kresge Foundation, which was founded in 1924 with a mission to promote human progress. Today, Kresge works to expand equity and opportunity in America's cities.
Read the stories of all of this season's PathBreakers and learn about our grant-making and social investing work in Detroit, Memphis, New Orleans, Fresno, and cities across the U.S. at Kresge.org. To hear more stories from the PathBreakers, be sure to subscribe to the show wherever you listen to podcasts.
Our producers are Juliet Heinley and Zach Rosen. Managing editor is Krista Yankee. Our show art is by Rochelle Baker and creative direction by Alejandro Herrera.
Thank you to my colleagues on the Human Services Program for lifting up Dr. Mona and speaking her name as a truly phenomenal pathbreaker. We'll talk to you next week.